I'm going to open up a meeting today. At least I hope I am. I'm going to share my screen. I'm going to get a PowerPoint. There we go. All right. Finally, this is a little bit better than I usually am able to work the effects of this new Zoom. I'm learning how to do Zoom to prepare trainings for our Yakima Nation Snout program, the adult program located in Copperas, Washington. At the end of the slides, I have my information, my contact information there. This is a brief um, overview of marijuana, the effects of marijuana, medical uses of marijuana, marijuana, try to say medical marijuana at the same time. Legalization of marijuana in our state in 2012, I believe it was, Washington State legalized the marijuana. We were the first state in the United States to actually do that. And here it states here, Washington State legalizes marijuana. Cannabis in Washington relates to a number of legislative, legal, and cultural events surrounding the use of cannabis, or more commonly known as marijuana, hash, THC, which is the main ingredient in marijuana, which gets the user high, keef, which is another derivative or street name for marijuana. On December 6, 2012, Washington became the first U.S. state to legalize recreational use of marijuana, the second recreational marijuana sales. The state has previously viewed medical marijuana in 1998, or legalized it rather. Under the state law, cannabis is legal for medical purposes and for any purpose by adults over 21 years of age. That made a lot of people happy, of course, because they wanted to have the recreational use be uh, optional in terms of not being criminalized or not being seen as a crime if they use marijuana, so that they'd be able to escape the law, so to speak, and not have the problem of being arrested due to marijuana use. Pharmacology, which is a big fancy word for how the body actually absorbs and utilizes each substance that we use, be it um, caffeine, tobacco, marijuana, alcohol, methamphetamine, codeine, prescription medications, all types of substances that we take in or ingest. Our bodies absorb it and then process it so it can be eliminated from our bodies. Administration, inhalation, or ingestion. You can smoke marijuana. You can drink marijuana as a tea. You can. They have edibles where you can make candy, suckers, cakes, marijuana. Those types of edible ingredients contain a large quantity of marijuana or THC. Action, the effects are on neurotransmitters. Serotonin and dopamine are two neurochemicals or hormones that our brains contain, so that uh, we can feel arousal or we can feel pleasure. We can actually contain or control our moods. This is one of the neurochemicals, dopamine. It says in popular culture, media, dopamine is usually seen as the main chemical of pleasure, but the current opinion in pharmacology is that dopamine instead confers motivational salience, or can reduce salience. So if you smoke marijuana, it is commonly known to actually um, reduce inhibition, reduce ambition, stop the progress, so to speak, and the person's motivational options for the day or for their career, for their life circumstances. And so we've seen commercials that contain marijuana use in the past. There's no longer any commercials about that without a medical purpose. And where the person using didn't have a job, dropped out of school. If they did have a job, they lost a job due to marijuana use. If they had a family, sometimes they could lose the family based on that use. Also, it increased to other problems, as well as just smoking marijuana or eating marijuana or drinking marijuana. A person can lose their income from employment, can lose their family because of usage, and don't feel the need to get treatment. In other words, dopamine signals a perceived motivational prominence, meaning I have a strong desire to use the drug as opposed to a strong desire to gain employment or to get an education or to succeed in my life goals for myself. It says here the desirability or aversiveness, meaning to avoid an outcome in terms of using marijuana, the dopamine receptor actually is activated and receives pleasure from the use of substances, even just eating foods, watching a movie, hiking up a hiking trail, going swimming, jogging, what have you. All of those activities will produce a certain amount of dopamine release in the neurotransmitters so that we feel pleasure from our activities. And that's a good thing. To feel pleasure is a good thing. People want that. I believe we live in a world that is a hedonistic world and is only in pursuit of pleasure almost at all times. It says this propels our organisms or us ourselves to move toward or away from a substance use in our lives. So you can get too much or you can get too little because once your dopamine receptors are released, you actually your body has to replenish those dopamine hormones, and that's going to take some time because we don't naturally have a replacement for hormones once they're used up. We usually have them remade overnight as we sleep. Now, the next serotonin or next hormone or neurochemical is serotonin. Here's a definition on the screen. You'll be able to see that. It says it's a hydroxytryptamine. They go fancy words, say that 5 times, right? Is a monoamine neurotransmitter. Mono meaning one, amine meaning the amine molecular structure in our bodies or in our brains, rather. Monoamine meaning a single molecule in the amine group. It's a biological function and a complex and multifaceted modulating mood condition for cognition, reward, learning, memory, and numerous physiological processes such as vomiting or vasoconstriction, meaning that it's becoming harder to breathe. That's what that big old fancy word there means. So that's what these two chemicals are intended to do. The dopamine is to derive pleasure from an activity, and serotonin is to modulate or control our moods, our learning, and memories in terms of how we go through our days, and process our life information. The effects of marijuana, physiological means your body, how your body is affected by the marijuana use. It increases your heart rate, bronchodilation initially. Bronchodilation is where your bronchial system, your respiratory system is affected adversely because of the marijuana use. It constrict or narrow your airways, slows reaction time, impaired motor coordination. Motor coordination means when you tie your shoes, comb your hair, steer your car, put on brakes in your car, that type of thing. That's what motor coordination is. Decreases short-term memory so that you are now with a deficit in terms of remembering things. Hardening or reddening of the eyes. Anybody who's ever smoked pot will remember the bloodshot eyes, that's for sure. I don't have a euphoric recall of that, but it has been 34 years, I believe, since I last used marijuana because I've been in recovery. I've been sober for all these years, and I have a new life. It's a new my red road to recovery, so to speak. It's used as a sedative, slows you down. The inhibitions, as I said, are no longer in control, and you become less inhibited and make more poor decisions based on that fact. And senses become more vivid or clear or more acute, more sharpened. They understand. Psychological, meaning how your brain interprets what's happening to you. Physiological is how your body is registering or sending signals to you as to what's happening. Says you have a dreamlike feeling, a sense of well-being, relaxation, euphoria, anxiety, panic reactions, hallucinations, or hearing things or seeing things. An audible hallucination is hearing things. A visual hallucination is seeing things. So those can be very critical in terms of how you're interpreting what's happening to you, whether it's a positive effect or a negative effect. And I personally don't believe, unless you're taking marijuana for a medical purpose, you're having a pleasurable effect that's going to result in a positive outcome in terms of your body being able to process the marijuana. Marijuana uses for medicines are for glaucoma, which is a eye disease, gout, which is a bone disease, HIV/AIDS patients when they don't have a appetite. Marijuana produces an appetite for that person. Those are some of the different medical purposes that cancer patients, also when they're taking radiation or chemotherapy treatments, the end result is a very painful after effect in terms of the type of pain you feel, because it also helps you with pain reduction if it's used for a medical purpose. Harmful effects to the brain, respiratory system, cardiovascular system, immune system. Effects are not permanent, can be reversed. The brain pathological changes, as I mentioned, the neurochemistry. Once you take in that chemical, your neurochemistry is changed because we have receptors in the brain that actually open and release the dopamine or serotonin chemicals within the body, which have to be replenished, as I mentioned in the slide before. The respiratory system, cancerous growth, bronchoconstriction, or a reduction in your breathing capacity. There's a lot of harm that is done. Marijuana is one of the top three leading causes of people entering into the emergency room departments in our country. Alcohol is number one, marijuana is number two, and I believe cocaine is number three for the most harmful substances that are causing emergency room department visits. Cardiovascular is your heart in terms of how uh, marijuana impacts your heart, how much you're breathing, your breathing capacity is restricted, your blood pressure is changed or increased, which is never a good thing, and your immune system is mildly suppressed, meaning that you can possibly get a ailment a lot easier because of the use of marijuana. Medical uses, some decreased nausea, increased appetite. I mentioned that for the cancer patients. Decreased intraocular pressure or fluid in the eyes, um, which is a problem with people that have eye disorders or eye disease. There's decreased muscle spasms, where you have your intense muscle twitches, involuntary, meaning it's happening without your permission, so to speak, or without you cognitively thinking about moving a muscle or part of your body. Is spasmodic in that it's moving without your permission, not without your knowledge, but without your permission. Decreased in pain, decreased seizures, anxiety can be used as an anti-anxiety medication. Bronchodilation or makes breathing easier if you're able to use that, excuse me, that for a breathing or respiratory problem. Drug schedules. This is drug marijuana is a Schedule One drug. The department or the Drug Enforcement Agency came out with the classifications or drug schedules for substances in 1972, I believe it is. And here is a list of the drug schedules and their potency and their risk of potential harm and addiction. Schedule 1 drug substances are chemicals defined as drugs with no accepted medical purposes and have a high potential for abuse. Some examples are heroin, LSD or lysergic acid diethylamide. These words are so convoluted or very difficult. Marijuana or cannabis, methamphetamine, methaqualudes, ecstasy, or MDM, which is a stimulant type of a drug, which can cause hallucinatory and auditory um, hallucinations. Schedule 2 drugs are the same substances or chemical drugs with high potential for abuse, like hydrocodones, methamphetamines, or Ritalins. Schedule 3 drugs are substances or chemicals with a moderate to low potential for abuse. Schedule 4 drugs are Valiums, Ambien, sleeping tablets, muscle relaxers, those types of drugs. A lot lower potential for substance use. As the number increases in classification 1, 2, 3, 4, and 5, 5 being the most innocent or harmless substances in terms of potential for abuse or addiction, and 1 being the highest or the highest potential for addiction. Number 5, scheduled drugs are over the counter type of medications, syrups, Robitussin, that type of thing. So those are the scheduled drugs there. Legal terms, decriminalization reduces the penalty for possession and use of marijuana as a misdemeanor instead of a felony. Legalization of approved or authorized behavior could still be regulated for age, location, production, distribution, and a proper amount of taxes being applied to it. Marijuana law in the state of Washington, Initiative 502, as I mentioned, I believe it was 2012. The state of Washington became the first state in our country to actually legalize marijuana. The age limit is 21 or older, and you can purchase marijuana from many of our outlets in this Yakima area where I'm located at. Uh, it's in central Washington, Yakima is. Purchase limits are age 21. You can purchase up to an ounce of usable marijuana. Harvested flowers or buds, 16 ounces of marijuana, infused edibles in solid form, 72 ounces of liquid form, or 7 grams of marijuana concentrates, which are like juices, I believe. Concentrates, that's what I get from that word there, just like orange juice. So that can be turned into a larger quantity of a beverage, just adding water. Buying and selling marijuana can only be sold and purchased at state licensed retail stores. So you have to have a license by the Washington State Liquor and Tobacco Control Board for them to authorize you to do that. It says public use. It's illegal to use marijuana in the public view, so you can't just walk around Safeway or Costco or Walmart and fire up a joint. It's just not going to be possible. Driving, it's illegal to drive under the influence of marijuana. There still are laws against driving with 5 nanograms of THC per milliliter of blood. Doing so may result in getting a driving while intoxicated ticket. 5 nanograms in our bodies naturally have a cannabis a component in our brains. And so we have 20 nanograms of cannabis in our systems naturally. So if you have a UA done and your screening comes back with 25 nanograms or 50 nanograms or 75 nanograms, whatever the number is, it could be in the thousands, depending on how much you use. That would tell us as providers that you've been using marijuana beyond what the natural substances in your body is recording in that urinalysis. Travel to legally take marijuana outside the state of Washington. Doing so may result in significant legal penalties. Now, here's a question or a set of questions for you, the attendee, once I publish this. Hopefully, I get a lot of people who view this, and we'll look at these last questions here. Should marijuana be legalized for medical uses? Pros versus cons. And they already are, so this is past tense. Medical uses are already authorized and legalized. It's just your own personal moral view of what you think should be happening with this substance in terms of how people use it. So please write your answer down to both of these questions. Send it back to Eric_Johnson at Yakima.com. That's going to be for those who work at my tribe. I'll be sending this out through the email for them. Then should marijuana be legalized for generalized use? Pros versus cons. So do we think it's going to be something as rampant or prevalent as alcohol use in America, where people are just going to stores and there's rows and rows and rows of alcohol? You can go to a supermarket and there's big gigantic rows of alcohol. You can go to a liquor store where they have nothing but liquor in there. Now our marijuana stores are a lot smaller in comparison to those types of sales. And so will it grow to that point? And would you accept it if it grew to that point? Would you accept the knowledge of alcohol and marijuana and other substances being taught to our children in terms of legal products and commerce so that they can be able to purchase something like that. I remember one time my daughter, I shared the story before, my daughter bought she was 14 and she tried to have me buy a energy drink. And I don't approve of energy drinks. So I took the energy drink out of the cart, gave it back to the cashier, let her know that I don't believe in using caffeine to gain energy. And so told my daughter when she turns 18, you can buy all the energy drinks you want. Until then, if I'm purchasing anything for the home, it's not going to be containing a substance. So caffeine is a substance that I don't approve of in my own life or in my daughter's life when she was younger. That's just an issue that I dealt with personally in terms of my own moral compass and what I see as right or what I believe to be right. I don't see everything as right the way you see it. So right or healthy or useful becomes subjective in terms of how we see everything. And now, last but not least, here is my information. Me, yours truly, Eric Johnson. I am the chemical dependency coordinator. I am the clinical supervisor of our program at the Yak Foundation Talent Program. My information is right there, our address, our PO box, our fax number, and such. And so that's who I am. If you want to get in contact with me, please do so. If you have any substance use issues that you're concerned with, or your children or family members have any concerns, give me a call, 509-865-5121, extension 4456, or to make an appointment directly with our facility, contact Aaron Buck at 509-865-5121, extension 4455. So thank you for attending today's brief overview of marijuana, and I will see you on the other side. A Tawish, which means I love you. And